Well, hello and welcome to More to the Story with Molly White. I'm so glad you joined me and my co host again today. But before we get started introducing Mary, my co host, I would just like to give a shout out to our sponsor, Dr. Stephen Hotze with the Hotze Health and Wellness Center. He's been a sponsor of ours since the get go. And we're very grateful for his sponsorship because he helps make this show happen and get produced and have a great producer behind the scenes. So we're very grateful to his sponsorship. And we're very grateful for those who have donated to this show on a regular, consistent basis. Your donations also help with this podcast and getting it out there. And we're very grateful for y'all too. And we want to invite you to be a sponsor of this show because we want to keep going because it's Mary's and my desire to talk about what the abortion industry doesn't want you to know. And that's what we do on every podcast. We expose the lies behind the abortion industry and we educate you on what they don't tell you. So this has been a passion of ours and we want to keep doing that. And so now I would like to introduce my awesome, wonderful co-host, Mary Brownie.
Thank you, Molly. It's so good to be on this show again today. And I'm excited about our guest. As you know, we have someone today that will be speaking about abortion. It won't be in detail because, as far as I know, she's not had an abortion. But we do want to warn our viewers and our listeners that if you hear something today that causes you to have an emotional reaction, that could just mean that you're being invited into another level of healing. Sometimes, if we have an abortion experience, we will have a reaction when we hear about that. And you can call the H3 helpline at 866-721-7881. And you can talk with counselors there that have abortion and experience of their own and can help you connect with the Healing Recovery Ministry if you're in need of that. And also, you can log on to operationoutcry.org. You can also find healing resources there as well. We thank you for joining us today. Thank you, Molly.
And thank you, Mary. It's always good to have you with me. And so we have a great guest on today. We just got to know her a little bit before the podcast. This is Dr. Poehailos. She is with Fem Health, and she's really an expert in, I guess, women's reproductive health, I would say. And so we're really looking forward to having her on our show. So welcome to the show, Dr. Poehailos.
Mm-hmm. Hi, thank you for having me. I'm excited to be here.
Great. Well, so why don't you give our audience just a brief introduction about who you are and what you do?
Wonderful. So I'm a family physician and I work full-time on a telemedicine platform for Fem Health, for Fem Foundation. And our mission is working restoratively to help women's hormonal health. We deal with issues ranging from teens with irregular bleeding all the way through to women in perimenopause and menopause. A lot of our care focuses on women with reproductive concerns, women who have had issues with infertility or subfertility, recurrent miscarriages, also women with mental health concerns such as anxiety or premenstrual syndrome, PMS. So my work daily runs the gamut of patients from like age 14 to 70 and trying to help women restoratively get their hormonal health back in line because the beauty of our design is that our hormones and our cycles aren't just there for when we are trying to get pregnant or when we are trying to avoid pregnancy, but also our hormones affect our brain, affect our bones, affect our heart, so much of us. So I really view it as a very wonderful opportunity to help women optimize and restore their health as they were designed.
Yes, and that's absolutely fantastic because I know general medicine and usually doesn't really focus a whole lot on hormonal health, in women. And so this is really fantastic of what you do. And it's so important, like you said. And I just wrote down real quick, what is subfertility?
So infertility would be inability to achieve pregnancy. Subfertility is more difficult too. So women there's also primary and secondary infertility. Primary infertility, a woman has never achieved a pregnancy. Secondary infertility, she has achieved a pregnancy, they're trying to have another pregnancy and they're not being able to achieve a second or third pregnancy or whatever number they're at. Subfertility to me is kind of like the women who are trying and they're able to get pregnant, but it's taking a lot longer than statistically would kind of be considered normal. One thing about that is often women are told when they're having trouble achieving pregnancy or is that, oh, wait till you've been trying a year or two before you see somebody, or, it's totally normal to wait a year and be trying and not get pregnant. Or if you're having miscarriage, that you need to have had 2 or 3 miscarriages before a doctor will talk to you about it. And that nothing could probably be farther from the truth there. We encourage women to learn how to track their cycles. And so FEMM, FEMM, is fertility education and medical management. So there's 2 arms of it. Fertility education is a big part of what we do, where we have women who are trained as instructors to work with women, and a lot of it can be done online. That's where it is nowadays. But we have an app that is available for free download in either of the major platforms, and women learn how to track their cycles and what is normal and what is abnormal. If a woman notices even in her teens that she's tracking and things aren't looking as they should, or she's working with a FEMM instructor and they say, this is not what a normal healthy cycle looks like, you don't need to wait for the miscarriages or wait for the infertility to start getting help with it.
Awesome.
And I work with a number of women who are learning how to track in college, and they are not married yet, but they're like, something's wrong here and I need help with it. So our goal would be to help them get healthier so that they're not having the miscarriages, and that when they are ready to start their family, their fertility is in the best place it can be.
Awesome. Well, that's something that's really new to us on our podcast, isn't it, Mary?
Yes, it is.
I really think it's important for our viewers and our listeners to understand, especially women, not to wait. Like you said, they're told by their general physicians or whatever, if you're having problems with your menstrual cycle or miscarriage, wait for a few years. Well, you're recommending that they get help right away to avoid problems in the future.
Right. We believe that women should learn about their fertility. Honestly, we have a program called Teen Femme where it's geared toward middle school students to teach them how to learn how to track their cycles. We're not teaching them family planning at that age, but we're teaching them literally just how to track their cycles, so that if they learn that early, they gain an appreciation for the beauty of how they were designed, and that they learn what's normal and what is abnormal. And it's funny and also very hard at times, not funny in the ha-ha sense, but I will meet with women who will say, oh, when I was in high school, my periods were terrible. I was on the floor. I'd miss school, throwing up. And everybody told me that was normal. It's not normal. And we want to empower women at all stages of their health and life to learn what is normal and expected, so that they can learn how to get themselves feeling better and
Amen. That's awesome.
Doctor, I have a question for you. I believe before we started recording, you mentioned that you are right now telemed. You're telemedicine. So I am wondering if you have any tips for our listeners if they were going to have a telemedicine appointment. What should they come to the appointment? How should they come prepared for the appointment?
Right. So if a woman was signing up with our platform, for example, for a visit, and we have most of the US covered, I have licenses, I think, in about 22 states, but I have other physicians and physician assistants and nurse practitioners who are also employed by FEMM on our platform. So we have a lot of states covered if you go to our website. When women schedule, our medical assistants and the people who do intake, ask them if they have been tracking their cycles with anything, can you send it to us? And we get a variety of charts. There's a variety of methods of fertility awareness that are out there. FEMM is, of course, one of them. But women may say, oh, I have a symptothermal method chart, or I use the app on my phone. Fine, send us what you have, because learning your bleeding pattern even is really helpful to us. We ask them if they have any former medical records, like if they have had blood work in the past year or two, please send that to us. If they have had an ultrasound or other imaging, please send that to us. So we have a questionnaire for them to fill out with their history, with their reproductive history, with their, how old were they when they started their periods, that kind of history. All that is obtained as part of the registration. So patients get walked through it, which is wonderful. So you're not having to guess what we're looking for.
Awesome.
And if you don't have anything, we will help you build it. In other words, we'll be ordering the ultrasound and ordering the blood work. But some women come and they have seen other people for things already, and we can look at what they've done and then build on that.
Awesome. Well, I have a couple questions too. So, one was recently about your questionnaire. So on your questionnaire, do you talk about, ask questions about their reproductive history, if they've had any previous pregnancies, pregnancy losses, or even abortion? Is that on one of your questionnaires?
Yes, ma'am, that is. We ask about pregnancy. We ask about preterm deliveries, term deliveries, spontaneous abortion or miscarriage, and then induced abortion.
Okay.
And so that's on our form. And if I'm doing an intake with a patient who's new to me, I will ask her about that if she wants to chat about it. Sometimes the women want to tell me their story. Other times they're more hesitant, but the form is there and I open up the window for them to talk about it if they wish.
Awesome. Because that's not always a question on women's questionnaires. Mm-hmm. Go see an OB-GYN. Abortion induced abortion is not normally on one of those questionnaires. That's kind of why I asked, because that's an important part of our medical history.
It very much is. Yeah.
Mm-hmm. And so then real quick, I know Mary's probably got tons of questions too. So you talked about Teen Fem. Is there a website that you would like to give out or an app,
Sure. So
something for that?
Our main website is FemHealth, FEMM health.org. And when you're there, you can find information about the app. You can find information about our teen classes. We have classes for women and men. For the teens, we have Teen Fem and Fem Men. And obviously, men are not learning to track cycles because they don't have them, but they are learning about respect for their bodies, about their hormonal health, and about how to be healthy. And also they do learn, each side learns a little bit about the anatomy on the other side so that they can understand. We feel that understanding is the key to learning how to use our bodies and our health well. So that information on all that is available off of that main page on the website. If anyone wants to schedule a telemedicine visit with one of our clinicians, you can find that information there as well.
Wonderful, because I have a teenage granddaughter who's been asking me a lot of questions about that.
We would love to help.
Yeah, about what, when can she expect, her cycle to start and all these things. So I'm so happy to have you on today because I can point her mother to your website.
There you go.
Yeah.
And I might mention that our producer dropped a question in the chat just about whether or not you offer mental health counseling for those people that do indicate that they have abortion in their past.
I will talk to women about it. We do not offer it through FEM. Mm-hmm. So if we have a woman who has mentioned that in her past, I will gently open the subject, and sometimes they will leave the window that, I'm still struggling with it. And I will talk with them because I used to work in a pregnancy medical clinic. So I'm pretty familiar with the resources, and I will talk to them about various resources that are out there, various healing ministries, and get, if they want information on that. I've also had, I remember in my year, I've had at least one patient I've worked with who had a pregnancy years ago that ended. She was probably in her teens, ended with an abortion that I believe from talking with her, she did not want. And then years later was struggling with infertility. And is this how God is punishing me? And you start unpacking that a little bit, but then again, I'm going to refer her to counseling. We don't offer it through us, but I'm certainly sensitive to the issue.
Awesome. That's wonderful.
I have just one more, Molly, and Molly knows this about me, doctor, but I have an abortion in my past, and for years and years and years, I never revealed it to anyone, and particularly not on my medical questionnaires with my doctors, even my OBGYN.
Mhm.
What for you, why is it important for you to have a complete medical history from people that are coming for your services?
Right, that's a great question. And often women are hesitant to reveal that part of them. Um, Sometimes when I talk to a patient about it, like I see that she's marked off an induced abortion on the form, and I'll say to her, I'll say, well, would you like to talk more about that? And sometimes, and parts of the question are definitely important in healthcare. Was it a chemical abortion? Was it a surgical abortion? How far along were you? Because certain things about that can increase the risk perhaps for premature labor if it was a surgical abortion done at a later point in gestation, because you have more chance of having injury to the cervix. Um, Also, just because I think it can be hard for women to want to talk about that. It's a painful topic. It's a very personal
Yes.
topic. They're just meeting me. I've had women who are Christians say, I have an abortion in my past. That was before I found the Lord. And I'm like, thank heavens you're here where you are right now.
Yeah.
So they may feel like it's a part of their past they don't want to see again.
Mhm.
They may perhaps just feel like, why does she need to know that? It does help me to know, because if I have a woman who has no children, but she has achieved a pregnancy, that may tell me certain things about her reproductive health that if she felt embarrassed and held that back, I don't know that she has been able to achieve a pregnancy. So when I'm looking at her whole story helps me figure out how to best help her.
Right, absolutely. And that's what I want to encourage our listeners and our viewers to understand the importance of telling your whole reproductive history to your doctor, such as Dr. Karen Poehailos, because if there is an issue, then she can help fix that or to help take you to a place where you can work on that physical issue.
Mhm.
Is that correct? Am I saying that the right way? To
Yeah,
help you achieve your reproductive dreams if possible. And
right.
without that information, for me and Mary, we're both had abortions in our past, and
Mhm.
we've worked with thousands of women, continue to do so. And we just know the importance of going through healing. You must
Right.
go through a healing process for your whole physical, emotional, mental, and spiritual well-being.
Mhm.
And so I encourage.
Abortion, right. Abortion healing ministry is really important. And like I said, I have a background working in pregnancy medical clinics, so I certainly do know that that's a thing.
Right,
And I am blessed to know how to help women find help that they are looking for in that. And we all have, I tell patients that, we all have parts of our story that are hard.
yeah, yeah,
And it may or may not be an induced abortion, but everybody has something that we are not particularly proud of. And um, it's okay. We're all human, but we are all looking for healing.
right, right, and
And
hold.
I serve as a physician on the Abortion Pill Reversal Network, and I work with women on a regular basis with that, where they started the abortion and then they're trying to, we're trying to reverse it with the progesterone. And those women sometimes are like, I did the thing that God won't forgive, or, why do you even want to talk to me? And I'm like, I wish I could, because a lot of these patients, maybe I'd be seeing them through a telemedicine visit because they're not close enough to me to drive. And, like, you are loved, you are valuable, and we are here to help.
Yeah,
Mhm.
man, that's wonderful. And I just have
Yes.
one more question here. Mary probably has some more too, but the link between mental health and our hormones.
Yes.
Yeah, because a lot of times I really don't didn't really recognize that our mental health could be associated with a hormonal imbalance. Can you talk about that?
Yes, we actually, in our training, we talk about it in our regular training when you learn to become a FEM medical provider. But we even had an advanced course where we spent the whole course digging more into mental health and hormones, because
Mhm.
Wow,
it's
wow,
that important.
it
And
is.
even certain methods of family planning, when women are doing like the Mirena IUDs, the levonorgestrel, that hormone blocks a step in making a chemical that's in the brain called allopregnanolone. And that hormone is actually responsible for helping nerve cells to have their protection and to heal, and for the little cells that help keep the nerve cells happy and healthy. And so if women are on these, they may notice issues with depression and wonder why. That can happen to women also with oral contraceptives. Why that can happen to women also with oral contraceptives, and they may notice depression and wonder why. And nobody will, you need to say, it could be because of the IUD or the birth control pill or the Depo-Provera shot. So realize that if you are feeling something in your mental health that you weren't expecting, it may well be related to the hormones, and that may lead a woman to say, okay, well, maybe I want to look at my family planning differently. I didn't realize that these hormones were literally affecting my brain.
Amen. Wow, that's good.
It's powerful stuff. I mean, I feel blessed to work with it. It's really powerful stuff.
It is. And speaking about birth control, there's so many different types. And I don't recall, because I have a chart. I used to do a lot of work at the UN, and we would create handouts and pamphlets with all kinds of information. And one was on birth control and the risks associated with each birth control method, the risk to your health. But I don't recall, and it may have been on there, haven't seen one in a long time, mental health or depression or anything like that.
Right.
I think that's a topic that I would love to have you come back on and just talk about the different birth control methods that you just mentioned, a few, maybe a little bit more in depth, so our listeners and viewers can understand that, there are risks involved, and there are, with each type.
Women, I think, are made to feel like, we talked about how they may want to hide their concerns about their prior decisions about an abortion. I think the mental health stuff, like, do you really want to tell your doctor that you have been really depressed since starting your Depo shots or whatever? Because, it's more or less, we're told that, this is the thing that's going to make your life better, and it's going to free you from worries about unwanted pregnancy or whatever. So you don't, if you're the person having the problem, you may think you're the only person having the problem. And if I tell my doctor I've been really depressed since doing this, are they going to think I'm crazy? I have seen one of the most impactful patients I've had with this has been a teenage girl who had issues with a lot of anxiety and at times just mood outbursts. And her mother was she's like, this isn't my kid. I don't know what's going on. And when we started it up, we found a couple hormonal issues with her, and things started getting better. And on a visit recently with her, she and her mom were like, I feel so much better now. So it wasn't just about fixing her cycle chart. As nice as that is, we love fixing cycle charts and making them look better. But this teenager was like, I actually feel better now. I feel like my emotions don't control me. And I am like, what a gift.
Wow. Amen.
And who would think that, her mom was astute enough to kind of say, one of my friends talked to me about this, that this could be hormonal. And when we worked her up and figured out things and we started working on things, this teenager feels that she has a new lease on life, that she feels so much better hormonally. So it's amazing. Sometimes I'm just like, wow, I can't believe I get the chance to work with this on a regular basis. Other days are really hard and I say, wow. But, in general, at the end of the day, I usually sit there and think, wow, I've had such an opportunity to impact some lives today. And I'm grateful for my staff that help us do what we do.
Amen.
Doctor, I have a question about whether or not there is any connection between the hormonal levels and nutrition. Seems like I've known women that had trouble getting pregnant, and I remember seeing a book just about how different foods could help balance the hormonal levels.
You ladies are asking the best questions. So, hormones and nutrition, we talk about that as well. So there's a part of the brain where the signals from nutrition, things like insulin and leptin, where they actually talk to a part of the brain in the hypothalamus called the kisspeptinergic system, kisspeptins. It was actually, from what I remember being told once, that they found them in Hershey, Pennsylvania, and Hershey Kisses on the traffic lights. We used to live near there years ago. But anyway, the kisspeptinergic system is the link between your nutrition, and your cycle health. So think about, like, if you've ever heard of polycystic ovarian syndrome, PCOS, fairly common, fairly quite common endocrinology condition in women. We see lots of it. So if a woman, perhaps say, is a larger BMI and she has high insulin levels, she has insulin resistance. Those high insulin levels are talking through the kisspeptinergic system to her reproductive hormones. So when you have a woman, say, coming into the pregnancy medical clinic who wants to have a pregnancy test because she hasn't had a cycle in 3 months, well, we might find that PCO is a very likely possibility in her. And literally, if you work on the nutrition and the insulin resistance and lifestyle and things like that, along with medications, but if we work on that, we can restore cycle health. I have had patients where they would cycle 2 or 3 times a year, and now they're cycling every 28 to 30 days. And they're like, I couldn't believe that, my doctor told me the only way to do that was to go on the pill, but the pill is not fixing cycles, it's replacing them.
Wow.
And what we're trying to do is get them healthier so that their own body, which we're programmed to try to be hormonally healthy, we need to get the program back. So by fixing the nutrition and treating the insulin resistance, we can actually get her brain to make the correct connections again and help her to restore normal length cycles. And that's a fix that's going to stay with her. If you stop the pills and you didn't do anything else, you're going to go back to cycling every 3 months.
Wow. That's amazing. I want to do another whole podcast on hormonal health and nutrition.
We're here for you, and I have wonderful colleagues. We would be totally happy to help you with that.
That would be awesome. Mary, do you have something else? I mean,
I have a couple of things. One thing is, I just remember years ago when I actually went on birth control to try to regulate my cycle. But the side effect, I had such horrible headaches. I already had a problem with headaches. So I just want to acknowledge what you're offering to the women out there and to men, not about the cycle, but just about health, that I just appreciate you. And I'm wondering if you've seen trends that you'd like to speak to our listeners about in terms of the people that you help, and see any trends.
Yes, because I've been at this for quite a while, working with this. And initially, when I started getting into it, it was because I was learning to follow the teachings of my church. I'm Roman Catholic, and I learned after getting into my career that as a Catholic physician, I really, if I was following the teachings of my church, should not be doing certain things like writing the birth control pill. So when I first learned this, to me, I almost felt like, and I've shared this with others, I almost felt like I had to apologize for it. Like, oh gosh, I'm sorry, I can't do this anymore, but here, let's talk about cycle charts. And as I moved through my career and took medical training in this and learned more and more and saw more and more, I don't need to apologize anymore, because women, I'm offering something so much better than what I used to offer when I wrote the pill. We're actually working to restore their health. We're not trying to cover it up. And that's reflected in the patients I see. So when I first started doing this, a lot of my patients were fellow Catholics who wanted to work on these issues and couldn't do the pill. So here's how we did it. I've moved forward now to women who have no idea about any religion teachings on anything, but they're like, I just realized that, some women were on the pill or an IUD and felt badly, or had depot shots and felt badly, or they go on to podcasts. There are some amazing podcasts about restorative reproductive medicine, and they're like, oh, I saw so-and-so's podcast about how, this could reflect whatever. So they start looking up online and they're like, okay, we're going to go to FEM and see if we can get help with this. So it used to be, and I still do have women who see me because they are coming at this from a religious or respect life aspect about the pro-life portions of this. But I also do have women who are just like, we want to get healthier. And I love when we have that moment of, I want to get healthier, because then I can work with them in a restorative way that is just going to bring beauty and respect for the way their body was designed to them. And it's amazing.
And not introduce dangerous chemicals into your system. I went through a pretty big gamut when it came to birth control, because I was on it as a young woman. They say it was going to help my reproductive cycles. You know how it was. And And then, of course, becoming a believer and then teaching and reading the Bible and learning. I thought, oh, no, God didn't, this is not God's design. Number one, there's other ways to do that. But even if you're out there and you feel like, you need to be on the birth control, it should not be for your whole entire life. It should
Our bodies,
be
so
productive.
our medical, we are tied with FEM. Our medical arm is the Reproductive Health Research Institute. Now, it's not the clinic through which you see the patients. That is FEM Health, if I don't want viewers to get confused. But our research back end is Reproductive Health Research Institute, RHRI. And our director for that is Dr. Pilar Vigil from Santiago, Chile. She is absolutely amazing. But she has written and talked and published, she's published a zillion things, but ovulation is a sign of health. So when you go to the doctor's office and they are taking your blood pressure and your pulse and getting your height and weight and all the things, for women, our cycle health should be considered a part of that. Like, what is your cycle like? And like I said before, our hormones aren't just there for turning on and off when we're trying to get pregnant or not. They matter to so many parts of us, and knowing where they are at any given point is so important. So yeah, I encourage women that to keep an open mind and heart on this, because it is very scientific. We spend a lot of time in continuing education hours on keeping up with the updates in this field. And fortunately, there's a lot of research going on in this field, and we learn more and more how to help women with various issues year to year. Even our regular yearly course, I always come home with something new that she didn't talk about the year before. So it's a growing area in research, and we are here because we love women and want to genuinely help them.
Amen. We want real health, good health.
We want real health that's not covering up a problem. I've seen patients sometimes where, they were put on the pill for years and years for painful periods, and it was endometriosis that was not being addressed. And then they want to have their child, they stop the pill, and they still, the painful periods come back and they're having trouble getting pregnant. And at some point they end up having surgery and finding advanced endometriosis because nobody earlier thought about, let's work on the inflammation. Let's try to fix things. Do we need a surgery? Everybody just said, oh my gosh, go on the pill. It will fix everything. You find out that it didn't.
Well, this has been fascinating. Mary, do you have any other follow-up questions? Because I know we're running out of time.
I know we're out of time. I think I know you also wanted to ask about breast cancer, but maybe that'll be for the next episode.
Absolutely. We'd love
that would be a longer discussion.
Yes.
Yeah. We'd love to have you on, Dr. Poehailos. It's been fantastic, and I know that this information is so important for our listeners and our viewers, and I encourage you to check out her podcast at FEM.
Our website is femhealth.org.
Yeah, that's right, your website, femhealth.org, which I'm going to be going to. And we'd love to have you back on, and even the researcher you were talking about, because I just feel like this is such important information that doesn't get talked about on a wide scale. And I think our listeners and our viewers are going to really appreciate this information. So we'd love to have you back on again.
I would love the opportunity. And like I said, I have wonderful colleagues. We would love the chance to be able to continue the conversation.
Well, thank you. And thank you for coming on today. Mary, are we got anything else before we close?
Well, I think on the next episode that we have with the doctor, I'd like to also talk about her experience with the Abortion Pill Rescue Network.
Oh, so, yes.
We just have a few things that we want to talk to you, a few more things to talk to you about.
Well, I've got my notes here, so we've got several more podcasts that we would like to have you back on.
We'll keep you busy. It's all good. And you guys can keep us busy.
Good. Well, thank you so much. Thank you, Dr. Poehailos. Thank you, Mary. And thank you all for tuning in to More to the Story with Molly White. And we look forward to seeing you again next time. And we look forward to having Dr. Poehailos back on and her colleagues too. God bless you. Bye-bye.
Thank you.